type.
Right, the rarer form. The NIA also points out a strong link with Down syndrome.
Yes. People with Down syndrome have a much higher risk of getting Alzheimer's, and earlier, often in their 50s or 60s.
Why is that?
It's because they have an extra copy of chromosome 21, and that chromosome carries the APB gene, the one involved in making amyloid protein.
Ah, so more gene, more protein.
Exactly. More APP leads to more amyloid precursor protein, which leads to more beta amyloid plaques building up faster. It's estimated maybe half or more of adults with Down syndrome eventually develop Alzheimer's dementia.
And what about the APOE gene? That one comes up a lot.
APOE is definitely important for the common late onset form. It has different versions or alleles. One version, APOE4, significantly increases risk.
Increases risk, right?
And it might be linked to earlier onset in some people. On the flip side, another version, APOE2, seems to offer some protection, lowering the risk.
So even with APOE4, it's not a guarantee you'll get Alzheimer's.
No, absolutely not. The NIA is very clear. Having a risk gene like APOE4 doesn't seal your fate.
Right.
It's just one factor among many other genes. Health, environment, lifestyle. It's a complex puzzle, not genetic destiny for most people.
Okay, so moving beyond genes, what about our general health, our lifestyle? Does that factor in?
It looks like it does. There's a lot of research connecting brain health to heart health.
Ah, the vascular connection again.
Exactly. Things like heart disease, stroke, high blood pressure, also metabolic issues like diabetes and obesity. Managing the risks for those conditions might also help protect the brain. Healthier blood vessels mean a healthier brain, potentially.
And just general healthy habits. Diet, exercise, staying active.
The NIA highlights those too. A balanced diet, regular physical activity, staying socially engaged, keeping your mind active. These are all linked to healthy aging in general.
Makes sense.
And the thinking is they probably help reduce the risk of cognitive decline and maybe Alzheimer's too. Though, more research is needed to prove direct cause and effect and test specific interventions.
But it seems like living a generally healthy life is probably good for your brain, regardless. Okay, so if someone is worried about their memory or thinking, how do doctors figure out if it's Alzheimer's? What's the diagnosis process like?
It's usually a pretty comprehensive process, according to the NIA. Not just one quick test.
Right.
It starts with a thorough interview. The doctor talks to the person, often a family member too, asking about health, medications, including over-the-counter stuff, diet, medical history, how they're managing daily activities, any changes in mood or personality, getting the full picture.
Okay, gathering all the background. Then what? Tests.
Yeah, physical and neurological exams and specific tests for cognitive function, memory, problem-solving, attention, language, things like that.
Right.
They'll usually do standard blood and urine tests as well, mainly to rule out other medical conditions that could cause similar symptoms.
Like thyroid problems or vitamin deficiencies?
Exactly. And they might screen for depression too, since that can affect cognition.
Are there tests that look for Alzheimer's specifically?
Yes, more specialized tests are becoming available. Sometimes a spinal tap lumbar puncture to measure amyloid and tau proteins in the cerebrospinal fluid. Or newer blood tests are being developed to measure these proteins too.
Right, the biomarkers.
And brain scans, CT, MRI, or PE scans. These can show brain structure, shrinkage patterns, or even detect plaques and tangles directly with specialized PE scans. They also help rule out other things like strokes or tumors.
So it's about putting all these pieces together, ruling things out. Do they repeat these tests?
Often, yes. Repeating cognitive tests, maybe scans, over time helps track changes, see how things are progressing. It helps confirm the diagnosis and understand the stage.
So what's the single most important thing someone should do if they have these kinds of worries?
See a doctor. That's the key message from the NIA. Get checked out.
Right.
Because it might not be Alzheimer's. It could be something else, side effects of medication, sleep problems, an infection, depression, another type of dementia, some of which might be treatable or even reversible. Early evaluation is crucial.
And if it is Alzheimer's, what are the benefits of getting that diagnosis early?
Several big benefits. Starting available treatments earlier might help preserve function for longer.
Okay.
It gives the person and their family more time to plan finances, legal stuff, future care, safety, building a support system.
Planning ahead is huge, I imagine.
Definitely. And an early diagnosis also means more opportunities to participate in clinical trials, testing new potential treatments.
Right, contributing to the research. It sounds like finding out early, even if it's difficult news, really empowers people. Okay, let's talk treatment. Is there a cure?
Unfortunately, no. The NIA is very clear. Alzheimer's is incredibly complex, and right now there's no cure to stop or reverse it. And because it's so complex, it's unlikely there'll be one single magic bullet treatment.
Sure.
But there's a ton of research happening, clinical trials testing many different approaches.
So no cure yet, but are there any treatments that help?
Yes, we now have some medications approved that actually target the underlying disease processes, like amyloid buildup.
Okay, disease-modifying therapies.
Right. And there are older medications that can temporarily help improve memory and thinking for some people. Plus, importantly, there are ways drugs and non-drug strategies to manage the behavioral and psychological symptoms that often come with the disease.
What kinds of behavioral or psychological symptoms are common?
Things like sleeplessness, depression, anxiety, agitation, irritability, sometimes delusions or hallucinations.
That sounds really challenging to manage.
It can be. Scientists are studying why these happen and how best to manage them, both with medication and non-drug approaches, like figuring out triggers for agitation or creating calm routines. Helping with these symptoms can make a huge difference to quality of life for the person and their caregivers.
Are specific drugs used for these symptoms, like antidepressants?
Yes, antidepressants, anti-anxiety meds, sometimes antipsychotics might be used, but the NIA stresses caution. These should usually be tried after non-drug approaches.
Okay.
It's really about carefully weighing the benefits and risks with the doctor, finding what works best for that individual.
A very personalized approach then. And you mentioned clinical trials. Why is it so important for people to volunteer for those?
Clinical trials are absolutely essential. They're how we learn more about the disease and test if new treatments are safe and effective.
Right.
People who volunteer, whether they have Alzheimer's, MCI, are at risk, or are even healthy older adults. They're directly helping move science forward. Their participation is crucial for finding better treatments and maybe one day prevention or a cure.
It's such a difficult journey, not just for the person with Alzheimer's, but for their families, their caregivers. What kind of support does the NIA mention for them?
The NIA definitely acknowledges the huge burden, physical, emotional, financial,
Yeah?
day-to-day care, changing family roles, tough decisions about care facilities. It's incredibly stressful. They support research into programs and resources to help caregivers cope and improve quality of life for everyone involved.
What kind of advice or support helps caregivers most?
Education is key. Learning about the disease stages, how to handle challenging behaviors, communication strategies that really helps.
Being prepared.
Exactly. Also, developing good coping skills, building a strong support network, friends, family, other caregivers, and using respite care, getting breaks, is absolutely vital for the caregiver's own health.
Taking care of the caregiver, too.
Definitely. Even simple things like staying physically active can help caregivers manage stress.
And support groups. Are they helpful?
Hugely helpful for many. They offer a place to connect with others who understand. Share worries, get practical tips, find emotional comfort. It combats the isolation many caregivers feel. There are groups in person, online, some specifically for early-stage families, too.
Good to know those exist. The NIA also lists some organizations for more info and support. Can you name a few?
Sure. The NIA's own ADIR Center is great. That's 1-800-438-4380 or nia.ni.gov Alzheimer's.
Okay.
Alzheimers.gov is another comprehensive government resource. The Elder Care Locator can connect you to local services, 1-800-677-1116. Medline Plus has reliable health info. And two major nonprofits are the Alzheimer's Association, 1-800-272-3900, and the Alzheimer's Foundation of America, 1-866-232-8484. Lots of support out there.
That's a really valuable list. Okay, as we wrap up this deep dive based on the NIA's insights, what are the main things you hope listeners take away?
I think, first, just understanding Alzheimer's is a complex brain disease, serious impact.
Right.
It involves specific brain changes, plaques, tangles. It progresses through stages. It's caused by a mix of factors, age, genes, environment, lifestyle. And while there's no cure yet, getting an early diagnosis, using available treatments, and getting support for everyone involved, that can really help manage the disease and improve quality of life.
Absolutely. Knowledge is power, right? And maybe here's a final thought to leave everyone with. With all this research into the very earliest brain changes, sometimes years before symptoms, how might future prevention strategies change everything? How might that reshape how we think about aging and brain health altogether?
That's a fascinating question. Imagine identifying risk and intervening before the damage really takes hold.
Yeah, it really highlights the hope and the incredible amount of work going on in this field.
It really does. Relentless effort.
Well, thank you for joining us for this deep dive into Alzheimer's. Until next time, keep asking questions, keep learning.